Welcome to another episode of the Venari Podcast. As part of my HealthTech CEO series, it's a pleasure to introduce Nick Mercadante, CEO and founder of Pursue Care. Good to see you, Nick.
Nice to be on. Thanks for having me.
Yeah, no problem. Now, I obviously when we met, I was really intrigued by Pursue Care and really wanted to kind of bring you on to just take a little bit of a deeper dive, really, into the story. So, yeah, I mean, can you share a little bit more about Pursue Care and what made you start the company?
Part of it is my background. I've worked in healthcare my entire career, most of my life. I've joked on other podcasts that I think I started my healthcare career sweeping floors at my dad's pharmacy and kind of went from there at 6, 7 years old. So I think that's part of it is I've always kind of been mission driven in my career to solve challenging problems in healthcare. For the past decade or so, I've been working in behavioral health. One of the things that really kept coming up, 2015, 16, around that time, I was working in the behavioral health space in skilled nursing facilities. So mostly working around elder behavioral health, adjustment related disorders, dementia, Alzheimer's, things like that. But started seeing this creeping propensity of opioid dependence and opioid use disorder making its way into skilled nursing settings. And it wasn't always with the population you associate with skilled nursing, which is usually, older adults. It was everybody. It was, folks, I'm in my early 40s, like folks my age, younger, really sick, usually drop there like on a Friday night, an emergency room that's really busy, regional hospital, rural area, not a lot of healthcare options in the area. Everything's closed Friday. What happens when somebody's in crisis for opioids and it can't be solved with any type of chronic care in a hospital setting, right? So it's hot potato, right? Bounce them to the next place that can provide some level of nursing care and kind of hope for the best. And so that was, in that setting was my first interaction really with substance use disorder. And, but it started that inclination of like, what's actually going on here? What problem is manifesting itself? And it isn't just, what I think a lot of Americans equate with addiction, which is like, street drugs and kind of this criminal element. It's a healthcare problem. It's that we don't really offer any preventive or interventive healthcare that's in the settings in the community where people go for their healthcare. So what happens? It falls into crisis mode and it ends up in places it's not, and people don't get help until they hit the bottom. So that's really the story behind Pursue Care, was trying to solve upstream for that problem and try to bring better healthcare solutions to people that need them.
Fantastic. So when did you guys start?
We started with the concept in 2019. We got seed funding early 2019. So I think January, February, it was me in an office by myself, talking with former colleagues and getting folks to take a chance with me and on a new concept. And we kind of went from there. We started treating patients not even 12 months later. So I think we saw our first patients December 2019, and then we were kind of off to the races. And 3 or 4 months later, COVID started.
Great timing.
Yeah.
Yes.
Well, a lot of people say that. We didn't plan it that way. This is one of these areas where when you talk about kind of the venture world and investing, it's challenging because you say, well, look, the total addressable market is huge. And investors go, oh, that's great. And then you kind of think about the other side of that and you go, well, the total addressable market is a generational crisis of substance use disorder that's unmet need that's out there. It's a really, really challenging problem to solve, and folks are really suffering, right? And so I always like temper it with that, and some then investors go, oh yeah, that's right. But that's, I think, the exciting part is we have a great opportunity to create solutions with venture capital and in the for-profit sector that can solve this stuff in a really compelling human way. And when COVID started, everything was in disarray and hospitals were closing their doors. And actually, our preferred method for how we work, which is in integrative relationships with health systems, That was much harder at the beginning of COVID because everybody was kind of scrambling. As that's gone on, now health systems have really said, "Hey, we have a problem with addiction everywhere, and we need to solve that."
So to clarify then, was there no real offering that was similar to yours at that point? Were you kind of the first in the market that looked at that?
No, and actually, right now there's probably still too few of them.
Hmm.
I joke sometimes, and I guess the competitive side of me shouldn't say this, but you know, the healthcare side of me believes it is there could be 50 of our company and we still wouldn't solve the crisis that's out there in the need. That's just the reality is, in the United States right now, I think we're solving or we can treat maybe 20 to 25% of the known need for substance use disorder treatment. That's across all providers. And then I think getting it more into the realm of specialized medical care and collaborative care with in-community treaters, that's that next wave that is coming. And we're proud of the fact that we're part of that, and we had the intuition to kind of address it that way. I think there's probably a need for more to do it like we do.
I can imagine. I mean, I know that when we've discussed this in the past as well, there's like, significant barriers to, addiction and obviously mental health treatment is that kind of stigma that's
Yeah.
associated around it. How do you help to combat that?
It's hard, because stigma is such a pervasive element of, society, different populations that experience social determinants of health and socioeconomic determinants of health. How much money you have, where do you live, the color of your skin, all that's interwoven with the stigma of substance use disorder. But the
Hmm.
reality is that drug use is as old as humans, right? We probably need to be more accepting as a society of the fact that people are going to use drugs, and we need to give them a safety net for that. We need to give them education. We need to give them tools to make sure that they can do so safely
Hmm.
when they do, and then resources for treatment when they need extra help or when that substance use disorder is propelled by pain or trauma or behavioral health condition, as so many with addiction. That's really kind of part of the equation there is the comorbid mental health and pain management conditions.
And tell me how Pursue Care does that then in sense. And like you say, I know that there's no maybe key differentiator versus some of your competitors and that there could be space for more, but how do you work in that sense? What is
Yeah, the big thing for us, is yes, we have that differentiator of that we work really hard to create collaborative relationships with health systems, hospitals, community health, really any place where someone could be presenting and benefit from preventive care for substance use disorder and mental health, or interventive care. Someone that can come in and say, look, this is the type of treatment that would help you. Let's get you into that. But we're not just a navigator for that. I think there's a lot of like connector programs, but the issue is always, what are you connecting them to? And the big thing for us is that we are a full-scale healthcare treater. So we are providing tech-enabled health services. We're doing medical care for substance use disorder, commonly medications for opioid use like buprenorphine, Suboxone. We do psychiatric care for comorbid or concurrent mental health conditions. We're doing counseling and therapy for addiction and mental health. And then we also do something called case management, or targeted case management, which is a non-clinical interventionist that's helping with resources around a patient. So that what we were talking about with social determinants of health and stigma, frequently that's the person that's kind of riding shotgun with you through this experience, that could be providing peer support and services, but also could be getting you into primary care and helping with food insecurity and helping with if you were justice involved and you have probation requirements, things like that. So we're very proud of that service that we offer. And then the other thing that we've added into our service offering is we have our own pharmacy. One of the things that people with substance use disorder struggle with is going to a local pharmacy. I mean, the stigma of walking in and seeing people are waiting in line, knowing that somebody might call out the medication you're taking, and frequently they get turned away from pharmacies. So we have that as part of the offering, and we can ship medications to patients. We wrap all that up in on a platform for care. Most of our patients are seen through an app that's in the Google Store or an Apple iOS. And they're doing video visits. So they're talking just like we are with their providers. It works very well. It's convenient. They can see their provider on their time and
Mm-hmm.
kind of go about their day. And that's a big thing for folks that, you know, they're working, they're taking care of kids. They can't take 2-3 hours out in a day to go to a clinic. So that's kind of the overarching picture. What we've started to do is also bring a lot of tech-enabled solutions into treatment. So we recently acquired Pear Therapeutics software-based medicine that's FDA approved for addiction treatment. That's called Reset and Reset O. And those are apps that deliver cognitive behavioral therapy that's specifically designed to help educate and kind of self-guide a patient on their treatment journey. And it works side by side with our treatment. So it's very exciting that we can offer these new interventions that didn't exist, you
Really?
know, 6-7 years ago.
That's at the forefront of where we are in digital therapeutics. It's amazing. In terms of the future on that as well, I mean, where do you see, I suppose, the biggest kind of challenges and opportunities for you at, Pursue Care, and where do you see yourselves in like the next 5 years or so?
Yeah, I think the biggest challenge, and it's for us, it's for the entire industry, is gaining widespread mainstream acceptance. That could be from the investment community. The markets have been very challenging with that. Look, I mean, this is not an easy space. We're not, printing t-shirts, right? It's complex. As you can tell from me explaining it, it's a lot of moving parts.
Absolutely.
And it's healthcare, and it's an area of healthcare that's stigmatized and has kind of been left behind for too long. So I think gaining that widespread acceptance from the investment community in the mainstream,
Hmm.
that this is something that it's okay to get addiction treatment before you hit the bottom. It shouldn't be stigmatized. It should be part of primary care, right? Something where you say, yeah, I'll do an assessment, and oh, you know what? I guess maybe I do need treatment. I'll talk with somebody. So I think that's a big piece of it. And then I think on the regulatory side, 50 states with 50 sets of regulations is really challenging. So I think, Congress and folks at the state level really need to come together and figure out unified regulations that work for the future of patient care, which is going to be via telemedicine. It's not going away.
Yeah, 100%. And do you ever see yourself kind of outside of the US as well, or do you think that's probably enough to cope with for now?
Well, so we are, currently exploring those opportunities, especially with the availability of Reset and Reset O as digital interventions. Those can really cross borders very easily. So we think we can potentially bring those to the outside world. We're very enthusiastic about the opportunity. This was something where we had previously had great success using Pear Therapeutics resources in our treatment, and then the opportunity arose that we could acquire them. So now we're kind of exploring all angles, and I do think that that's something where you can easily bring it to other countries and deliver the same sort of intervention there. And there's a need everywhere. It's not that the U.S. is just isolated with issues with substance use.
Thank you, Nick. Super excited to see what you guys have got in store, and thank you so much for joining us.
Thank you. I appreciate it. Thanks for having me on and giving me a little bit of time to ramble and share our story. I appreciate it.
Not at all. No, absolute pleasure, Nick. Thank you.
Thank you.